From the southeastern corner of western North Carolina, this is Polk Lore. I'm your host, James Hernishin. If you haven't had COVID by now, you almost certainly know at least a couple of people who have suffered through it. You may even have lost a close family member or a friend, although that seems to be relatively rare for the moment. Aside from the threat that this new coronavirus poses to our health, it's also taken a big toll on the economy. It's upended careers, shortening some, derailing or redirecting others. Not every business made it through. If you were a teacher, a student, or a parent over the last couple of years, you know that things are going to take a long time to get back to where they were. Something about COVID opened a floodgate of frustration with our schools, and if you haven't listened to the first 3 episodes of this podcast, cue them up after this one. It was tough on everyone, but no one had it as bad as the frontline healthcare workers. At some point, I want to sit down and have a long talk with some of them. But first, it seemed like a good idea to review Polk County's COVID experience with Josh Kennedy. As head of the county's Health and Human Services Agency, he was responsible for overseeing local efforts to respond to the pandemic. I joined him at the Womack Building in Columbus to discuss what went wrong, what went right, hey, the news isn't all bad, and how we can deal with the next one. Because there will be another pandemic at some point, and because there's no global or national response plan in place, it will again be up to each county and county staff to figure out what to do. Josh Kennedy, welcome to the podcast.
Thank you.
First, let's talk about exactly what you do in this county. So describe your position.
So we are a consolidated county in Polk County, which means we have a number of our health and human services under one umbrella. 2016, the county commissioners voted to consolidate some of the human services under one agency. The state law changed that smaller counties could do that. At the time, they brought in social services, veteran services, economic services, transportation, and senior services under that umbrella. And then in 2019, they brought in public health. Before that, the county was part of a 3-county health district, which included Rutherford, Polk, and McDowell, which that's where I came from. I was the assistant health director for the 3 counties before I came here to work for the consolidated agency. So Polk's probably one of 30 plus counties that are consolidated in the state of North Carolina. They all have varying levels of consolidation. Some is just social services and public health. Some is just social services. Some of it's other things. Ours is probably the one that has probably the most services under one umbrella. And we're probably one of the true consolidated counties in that there's only one director versus multiple levels of administration. Our goal, when I took this position in 2017, as the first consolidated director, was to push as much of the money, if you will, for staffing to the front line and not have a lot of overhead in terms of administration. So that's why we said just one director. And we have program managers that are qualified to do those program areas. So social services, which include child protective services, adult protective services. We got a program manager for that. Income services, economic services, or your food services, your FNS, your Medicaid, Work First. We've got a program manager for public health, and she also oversees senior services. And so it's a myriad of services, and the whole goal for that is so that we have some better wraparound. We often serve the same client. The same person who's writing transportation is probably also going to public health services or going to economic services. So by having this consolidated agency, we have the ability to really touch base, make sure that folks are getting served in a robust manner, and we're helping them move forward in life to a better position than when they entered our doorsteps. So
that kind of consolidation is a function of how small Polk County is. Really, we can't afford to have layers and layers of bureaucracy and duplicating services.
Yeah, consolidation works good in a small county for that reason. From an economic standpoint, yes. Consolidation works also from a good standpoint, large or small, because again, assuring that the service functions are talking to each other on a more regular basis and coordinating services better is better for the client or the indoor patient, depending on where they're going in general. I mean, we wanted to make sure that when folks hit our doorstep, when they leave our services, they're leaving in a better position than where they entered. And if you've ever tried to navigate a system where things are very much siloed, this department, that department, this department, it can be difficult for the person who's working through those services and may need all those services, but to navigate when do I go for this one? Where do I go for that one? When do I supposed to access this one? By having John Doe as part of our general patient client, hopefully we're doing a much better job of supporting them, coordinating their efforts to succeed in life. So
Yeah, it seems to make sense.
we think so.
Yeah. So, what's the primary mission of the health division?
Sure. So we are prevention, promotion, and protection. So we want to prevent disease, illness, harm in general. And harm is very broad. So again, when we say prevent, we're trying to prevent disease, we're trying to prevent chronic illness, we're trying to prevent injuries to you. Seatbelts, for example. Seatbelts was a public health initiative, back in the day. We're trying to protect lives. So when you think about harm, it's very broad. Promote. So we want to also promote healthy behaviors like not smoking, eating your fruits and vegetables, getting outside and exercising, and then protecting you from harm, whether that's environmental protections with environmental health services that we oversee for septic and well, your foodborne illnesses, protecting you from illness there at restaurants to make sure the restaurants are clean and operating in a safe manner. So prevention, promotion, and protection. Those three P's are important.
All right. Now, the reason that you're on this podcast is because we've had a really interesting last couple of years where people like yourself who kind of operated in the background, I think, found themselves, tasked with dealing with public debate, in a way that perhaps a lot of people like yourself haven't in the past. Vaccination is clearly one of the tools you can use to prevent and protect people, prevent diseases from spreading and protect people from those diseases. And before we talk about COVID specifically, how much attention does vaccination get from your division?
A lot. So one of our efforts, particularly within children, is we have childhood vaccination efforts. So going to school, you have to have certain vaccinations, your measles, mumps, rubella, et cetera. And so we work every summer with families in the community and the school system to say, okay, Johnny's not up to date on his vaccinations. How do we get him in? What's a good time for the parent, et cetera, to make sure that he's getting vaccinated. I mean, if you look back 100 years, you go to a graveyard, okay, and look back 100 years in that graveyard, how many of those graveyard headstones have children on them? It's going to be a good number. And as you progress through the decades therefrom, after that, up to the present day, you'll see less and less and less childhood deaths occurring. Why? Vaccinations, improvement in health, etc. That is the primary goal for us, is to make sure that you have the ability to live to a good, ripe old age. And without vaccinations, there's a good chance you won't. I mean, you're going to get sick. You're going to have illness. I mean, children will die from these diseases if they weren't vaccinated. And we've seen that over the past 100 years of progress with vaccinations.
Now, vaccinations, for people who understand the science behind them, are no longer particularly controversial. So, again, until COVID, how much pushback would you get from community when you're trying to, encourage people to get their kids vaccinated, or for adults to get vaccinated?
I would say limited. There was a false study that was published back in, I guess, early 2000s, maybe late 90s, around autism and
The
vaccine.
Wakefield study.
Yeah, which was totally debunked and whatnot. So unfortunately, that has, the internet being the internet of all things, people can Google anything they want and see any misguided information they'd like to see. But the reality is, vaccination is very safe, very effective at preventing disease and illness. And so, we generally don't see a lot of pushback up until recently, because it's good for you.
Yeah, when I was looking at this school my son was in Saluda School, it had, I think, pretty well 100% compliance rate with the vaccines. So, which is better than a lot of other districts.
Right.
So everything seemed fine, and then COVID comes along, and you faced some obstacles. And I'm looking at the data of even after it's been a year and a half since we've had vaccines available, right? We still only have, I think, 44.5% of the population that's eligible for vaccines, which is pretty much everyone now who's agreed to get them. What are the obstacles that you face in that explain those numbers?
I think it's just a mass amount of misinformation in the public internet sphere of life. You know, when we started with the vaccines, I can remember vividly getting those vaccines the 2 days before Christmas, if I remember correctly. They were delivered at 10 o'clock at our office. We knew they were coming. We had planned since October with a vaccine coalition. So back to your original point about in the background public health, supporting or doing all these good things to protect and promote and prevent disease and illness. We never operate public health, never operate in a silo. It's always in partnership with other folks. We cannot do the lift by ourselves. There's just too much work to be done and too many things to help folks get to a better spot in life. We always have to work in partnership. And that's how we want to operate. So we started in October of 2020, I guess now, with a vaccine coalition to make sure that we're meeting the needs of everyone in the community. We're being thoughtful about how to get folks in, make sure there's no barriers, make sure they have the information. We did a Zoom podcast, if you will, with the public and providers to really talk about the benefits of vaccines, how this is going to, what mRNA vaccines are and what they do and what they don't do. So we tried to get ahead of all those things so folks knew and had the information readily available ahead of time. And when those vaccines came, we walked, and 10 o'clock that morning, they came, hit our office. By 11 o'clock, we were at the hospital, at St. Luke's Hospital, in partnership with them and the Vaccine Coalition, vaccinating the providers, those frontline responders. And the level of euphoria that I think folks were feeling just from knowing that we've had this disease now on us for months, and here is an opportunity to protect lives and save lives and protect ourselves as we're protecting others was just incredible. The joy I think people felt, the doctors and nurses who were coming through, the frontline folks, being able to say, okay, I can do my job without having to worry about, am I going to take this home to my family? And is someone else going to get sick and die in my family as I'm protecting other folks? Am I going to be able to protect the public now better? That was great. I mean, that was the feeling. And, as time went on, we got into January, February, people stacking up lines and lines and lines, folks want to get vaccinated. It was going great through probably about May or so. We started getting to other parts of the population. And by then, the misinformation network had really gone into full force in terms of the vaccine. I mean, just the most um, probably obscene things like magnetism and just like, come on, that's not in the realm of reality. But we still charged ahead with trying to inform folks and giving the correct information about vaccines in general. So it is a challenge, and we're still working with the community to try and bring folks in. If they would like to get vaccinated, we're more than welcome to get them access to the vaccine. But it's going to be a hard uphill battle until I think folks just really understand the realities of vaccines and getting them the education on it.
Well, the problem and the reason why this podcast exists, from my point of view, is that folks like yourself have a finite amount of resources to try to spread the word, to educate the public. And on the other side, the anti-vaccine forces have entire national media organizations devoted to it. And, in the absence of a local television station or a radio station or a daily newspaper, people watch cable news.
Or Facebook.
And social media, certainly. How do you get around that?
You just keep putting out the message, keep going at it. You can't give up. At the end of the day, our job is to protect all, love all, serve all. That's my motto to everyone. Even through the tough times of this entire pandemic, the team's message for me was love all, serve all, no matter what. And you just got to keep going at it. You just can't give up. We do this job because we love helping people. If that wasn't the case, we wouldn't be doing this job.
How do you feel about the, I guess, success but limited success you've had? In a sense, I mean, we can compare the numbers in Polk County to the state as a whole, because the 62% of North Carolinians have gotten
Mhm.
vaccinated, but only 45% of Polk County residents. But we're actually better than some other counties.
We were the best out the gate when it came to getting the drive-through model up and running that we did at the Toronto Question Center. They were a great partner, letting us use their facility. We had the information ahead of time. So our goal with that vaccine coalition, we collected as much information on who wanted to get vaccinated. We knew they called us. We had a survey for those who couldn't have access to the internet. We had people calling people. We had our mini networks out there making sure the folks who don't have access to the internet, don't have transportation, could find out about the vaccine, could sign up ahead of time so they didn't have to wait and worry. And we knew who wanted to be vaccinated ahead of time so we could reach them. And that was the best part of our rollout. We had a fantastic rollout. And as the rest of the communities started catching up, until then, they were coming to us. We were serving folks from Buncombe, South Carolina, Rutherford County, which is fine. Our goal was public health is to protect everybody's life. But then, like I said, towards May of 2021, things really died off. It was really that mid-April, we started seeing a switch and just demand. There's more ubiquitous access in the state by then, so that was part of it. But um, it started slowing down. I do think when looking at our outcomes for the pandemic in comparison to our neighbors, our per capita death rate is much, much lower. We did a really good job in the very beginning of coordinating before vaccines, of coordinating our services amongst the fire folks, EMS folks, the hospital, and trying to work with our businesses and partners, let them know that there are things you can do to prevent your staff and your teams and your families from getting sick. And I think we did a really good job, even with the small team that we have, because it was a group effort by a lot of partners to communicate ways to protect. And so our death rate per capita was much lower than, say, Rutherford or I think we're on par with Transylvania County in terms of how well we did in terms of preventing disease and death.
Yeah, I think it's easy to look at the negative aspects of this. Again, and I was focusing on the number of or the percentage of people who have been vaccinated, but the death rate was really, really low. I mean, basically zero most of the time for the 2-week periods that were being
Yeah, we did a
reported.
really good job working with partners to make sure that, on the front end, to make sure that we could prevent disease and death. But those successive waves of Delta and Omicron, they were impactful. And it became an issue of how do we make sure that we don't overrun the services that are here to, if someone does get severely sick and ill, preventing them from not being able to get treatment at the hospital or through EMS to get transported. So that was when we realized we're about to get run over with Delta. And I said run over. It felt like almost like a war scene. Your front line's folding, you're folding back, you're falling back, you're falling back until you're at your emergency services line.
Well, I can remember that was the time when the school board didn't introduce a mask mandate right before the school year, and then they had to shut a bunch of schools right off the bat because that was a really difficult period. August, I
Yeah,
think.
August
Oh,
and through
September.
summer. Yeah.
Yeah, yeah.
So it was very important for us to make sure that we didn't overtax the services that are here to protect you, not just from COVID, but your car accident, your heart attack, whatever it may be that you may need a EMS truck to run you to the hospital. Because if they're moving other folks around for COVID as well, that's limiting the ability for other folks who weren't impacted by COVID to seek treatment and service and could have ancillary death from there. So that was part of our effort as well.
One of the problems in the discussion of the statistics regarding COVID is that the real death rate caused by diversion of resources is much higher than just the COVID-related
Sure.
deaths, and I mean globally speaking. So in Polk County, though, would you say that you were able to avoid a lot of that kind of secondary problem?
I think we did a really good job at avoiding as much as possible. I mean, we really worked hard. And I say we, the group of community partners. It wasn't just public health. I mean, it was EMS, it was the fire marshal and emergency management, Bobby Arledge, it was the county mayor's office, it was other partners in the community, the school system, St. Luke's, nonprofits, really trying to make sure that we can do our best to protect those here in Polk County. I always tell this story. When I started here in 2017, we had that mudslide. And I have never seen a community so well organized to come together in a moment of tragedy as that time when that happened. I mean, the community just pulled together, bootstrapped to make sure that folks were protected. That's what Polk County does well. And so what we saw with the beginning part of the pandemic and the vaccine rollout was people coming together at a time of immediate need and urgency to figure out how we're going to do this. Because we're Polk County, we don't got a lot of resources. Resources are in other counties. We don't have a lot of resources here like we do in bigger counties. How do we do this? And we did it. And I think that's what we saw as some of the outcomes is that folks just tried working together the best they could. So,
But you still got some work to do.
oh yeah,
Right. And there's still talk about the possibility of more strains coming in that might see the COVID rate increase again.
sure.
Do you feel that all your partners, the political elements as well as the bureaucratic elements, are they all on board with doing what needs to be done? Or, again, because misinformation is still out there.
I think so. Everyone's very much supportive of trying to make sure folks are safe and healthy. I mean, there's going to be now we're moving from this pandemic to endemic, stage. We anticipate there's going to be exposures, there's going to be encounters with COVID, SARS-CoV-2, but half the population is vaccinated. Portion has been boosted, and there'll be a seasonal regimen probably for several years as we work through an endemic level situation with COVID. I think there's also more access points now. It's not just us. The pharmacies now have access to it, and you can go there Monday through Friday on weekends, shopping, get your vaccines. So I don't know that it'll be the same level of structure, barring some sort of major genetic shift in the virus. I mean, we're going to see successive mutations. It's just evolution of how things work with viruses and bugs. They're going to evolve to try to invade. Their goal is to survive. The goal is to survive and replicate, and to do that, you have to evade certain things. But I don't see the same level of impact as we did with Omicron, just because of the mass number of folks and the highly contagiousness of Omicron variant. If you weren't vaccinated, you probably were impacted by Omicron just by moving around. And so that level of exposure has created or decreased the naivete of the body, the populist body, if you will, to the virus. So I don't know that we'll see the same level of impact with negative outcomes. I hope.
Right. But do you think you have the resources that you need? I mean, for instance, has your budget increased?
Yeah, so we've got some funding from the state for increasing our nursing staff so that we can make sure that we can ramp up if we need to do another vaccine clinic. Still got partnerships in place with our local EMS and other providers, pharmacies, et cetera, if we needed to do another mass vaccine rollout. What you probably don't know is that every single health department in the state of North Carolina is required to have a mass hazards plan, if you will, for flu and epidemics. So we were actually working on this in 2019 as we were launching public health under this umbrella of the agency, getting our plan ready and submitting it to the state. So we'd actually just gone through the process of making all these plans. So for us, it was I won't say old hat, but we were fresh. We knew what we were going to have to do in the event of a pandemic. Ironically, one of our presentations to our Health and Human Services Board in September was on pandemics. So this was like, we were ready, and we'll be ready again. We've got things coming at us left and right all the time that the public probably generally does not see, whether it's environmental health issues, whether it's foodborne issues at restaurants, whether it's the hepatitis outbreaks that are going on through North Carolina right now that have been going on, and now monkeypox. We're always ready.
Yeah, I wanted to ask you, should we be worried about monkeypox?
I mean, you've got to have some pretty direct exposure. It's not like COVID where it's respiratory in terms of like you can walk by somebody and have a brief conversation and catch it. But there's going to be things coming at us left and right all the time. We're in a global society where disease goes where people go. It doesn't recognize political boundaries. Doesn't recognize that you're in the United States, so you're not susceptible to these things. We're always ready for whatever comes our way, natural or otherwise.
All right. Well, what about what you've learned over the last couple of years that, obviously nobody anticipated having, well, no, that's not fair. I'll start over again.
We always anticipate.
Well, that's just it. I think that it's fair to say that you were trained and prepared to respond to a pandemic,
Right.
because that's part of your job description.
Right.
But COVID was something a lot of people didn't really expect.
Everyone's trained and prepared to respond to a pandemic in their county when it happens.
In theory,
I don't think anyone is. I don't think everyone anticipates necessarily or thinks it's going to happen. They do anticipate, but they don't think it's going to happen. A global pandemic in their lifetime, and that level of resource drain, if you will, from a global perspective, where every country is impacted needing PPE, needing vaccine, you name it, needing something to respond to the illness. That is a resource drain that I don't think people expect to happen in their lifetime. They plan for it, but they don't expect it to happen. And so when everybody needs that resource, that's when you start seeing things get a little more difficult. But I think, again, we were able to respond because we had a plan in place already. We were able to respond because we have partnerships in place already. We were able to respond because the community, when impacted, and I say community, Polk County, is impacted by a situation, it responds in a way of love and concern for neighbors. Even though that you may see some visceral things every now and so often, but the reality is when we want to help people and people want help, we've been able to get resources to them.
but I want to get back to this notion that there must have been some lessons to be learned.
Oh yeah, absolutely.
I mean, what would you do differently? What, if anything? I mean, I think you don't have infinite resources, but what did you learn from the last 2 years that you could apply to the next um, public health emergency?
Definitely need some more help with communication. I think, I mean, just in general, from not just us, I mean, just at a national, global level of making sure folks are well informed. There is the ubiquitous access of the internet means you can find anything on the internet, even if it's false. And reading for information is important. I think one of the best things I learned during graduate school is how to evaluate a, um, a research paper and look at statistics and read through for information. Is that a valid statistical tool they're using? Was the sample size appropriate? What's the margins of errors? That is what I see, and then I've got to find a way to interpret that and then break that down for folks, at a very basic level that they can quickly absorb and review. Because at the end of the day, people are living their life. This is my life. I mean, I'm a data geek. I like to look at papers and research papers and articles and dig into the nuts and bolts of things. But there are folks that they're feeding their kids, they're going to work, they're doing the grind every day. And so while this may be tantamount to me, this is what's going on, those folks are also doing their life, and we've got to find a way to make sure they can get the information in a reasonably effective and efficient manner so they feel informed and educated. When folks are informed and educated, they make good decisions. I mean, you think about outside of COVID, you think about other things that we try to do in terms of health promotion. Talk to you about, exercise and eating right and, avoiding things that are going to cause cancers like cigarettes, tobacco use. We want to make sure you're informed. When you're informed, properly informed with correct information, your outcomes are better. And we've seen that. Folks who weren't vaccinated, guess what happened? More likely to die from COVID. Folks who were vaccinated, informed, had the information, used the tools that were provided to them, less likely to die from COVID. I mean, there were times during Omicron when the case counts were so high, and there's the number of folks unvaccinated were at such greater risk of dying, like 11-fold at some points. I mean, the numbers are there. I mean, the number of deaths are there that are more unvaccinated than not.
I'm personally hoping that after a year and a half of having the vaccine, the misinformation at the beginning of that era is understandable because it's a new vaccine and we don't have these numbers. We don't see its efficacy yet because all we have is these abstract studies on people we don't know.
Right.
But the other day, I was talking to a guy at the bakery, and he said he knew 11 people in his family in Polk County who died of COVID, all of whom were unvaccinated. So, is it reasonable to expect that maybe after the dust has settled, people will say, "Yeah, okay, maybe I shouldn't have been paying so much attention to Facebook and, you know, far right media and just trust my local expert a bit more?
So I always sometimes start meetings. I'm your local friendly health director, because that's really what we're trying to be. Is your access to legitimate information that's researched and reviewed, and trying to put that in the context. So I remember an interview with WLS. I think it was right as the 5 to 11 was rolling out for vaccinations. Or no, it was 12 and older, because my kids are not yet 12 and older. I've got 3 boys. One just got vaccinated last week because he was under the 5 years range. And so when I was doing these presentations, these conversations, I'm talking to you as a parent myself. I'm talking to you as a patient myself, and doing the research on these vaccines because I wanted to know. I was curious. I mean, mRNA technology, that's new. That's neat. Let's dig into that. It's been around for 10 years plus. I mean, they've been working on mRNA vaccine technology for decades
Yeah.
plus. So this isn't new. It's just new because folks just aren't aware of it. So I was promoting from the fact of, listen, my kids are going to get vaccinated because I know the realities of this vaccine. I know the efficacy. I've seen in the research. I've gone through the 52-page document from the FDA on Pfizer, and Moderna and Johnson and Johnson. And so when my kids were eligible, absolutely, I was right there getting them vaccinated as soon as they were eligible.
Maybe we could just wrap up then with talking about that latest decision to allow the kids under 5 to get it.
Yeah.
I think, as I saw it on Facebook, that you ran clinics right off the bat.
Off the bat, as soon as we got the vaccine, we were out the door.
And what kind of response?
Limited. It was not the same level that we saw with the initial rollout with the older population. There's again misconception that this virus is not impactful to children, which is not true. The MMR, the mortality report from the CDC that comes out periodically. This was, I want to say, almost 6 months ago, maybe 10 months ago, indicated that if a child has severe symptoms from COVID-19 for longer than I think 4 days at the time, they were more likely to have some lingering heart issues that they need to go see their pediatrician, make sure everything's fine. But there is impact. We're learning that kids are more likely to be impacted by diabetes. The risk rate is higher for diabetes if they had COVID-19. Kids are also, again, it's a virus. It goes where it goes by people spreading it. Kids are also can be carriers of the vaccine, which would have impacted family members who were older. So again, there's this conception or misconception that children are not as impacted. They are impacted. They're impactful to us. They're impactful to themselves. And again, we don't want to see kids unnecessarily dying from the illness. And there were several hundred kids who passed away from COVID and COVID-related issues, MIS, multi-inflammatory syndrome. I've got 3 boys, and prior to the rollout of the vaccine, I was doing everything possible to protect them because I don't know that I could live with myself knowing that my kids got impacted by COVID because I did something that was foolish, to impact them. They went to school like everybody else did, but they wore masks. We still had to learn, study, but do what you can to protect your children. And they're the most precious thing to me. And so I would do everything possible, including getting them vaccinated for all their, vaccines, including the flu shot every year, because I do not want them getting sick. I want them to live a healthy, happy life. And I know these things are good and they're effective, and they will help them get to a good ripe old age of 100, and hopefully they'll take care of me in my old age.
Certainly, that kind of message should be pretty compelling to most people if it can get through the noise of all the counterproductive messaging.
Well, I've been working in public health now for a number of years, and every time we talk about trying to get the word out about, certain exercise or eating right or whatnot, you got to remember that there is billions of dollars in marketing against you. So when we talk about go eat some fruits and vegetables, Doritos in them, they have a lot of money. We're combating really glossy ads with a budget that is infinitesimal compared to theirs. And so again, that's why I work in partnerships. because it's about who you know sometimes and working with trusted sources. So that's why I worked with the fire departments, EMS, nonprofits. These are trusted sources who aren't there to have any other underlying reason to give you information other than the fact that they love you, you're in their neighborhood, they support you, they want you to be well. These bots on the internet and whatnot have, they don't know you. They're often tied to some other reason as to why they're doing what they're doing. My only reason to doing what I'm doing is because I care about the community and I'm trying to protect the community. And I think that message should be the foundation as to why everyone's doing the job they're doing.
Last question. What advice can you offer someone who's still struggling maybe to get out of whatever political box they have been in, and they're just not quite there yet with, they're not on board with COVID vaccines?
Right. They can talk to their provider. Talk to their healthcare provider that they trust and know, they've known for years. Talk to them about it because the providers know, and they have the information handy, and they are the ones who are going to say, yes, this is an effective vaccine. It is safe. So if you want to protect yourself or others, go ahead and get vaccinated, whether it's for COVID or flu. Flu is also very deadly still. I mean, people die from flu every year, but it's just folks know about it. And so it's probably a little more ubiquitous in their mind. But, these vaccines are, again, no one wants to be out of work sick. No one wants to miss time from work. Nobody wants to impact their loved ones and get them sick. There's a cost to this whole thing. There's a financial cost to this whole thing, too. I mean, when we used to talk about tobacco prevention within the workplace when I worked in McDowell County, we talked to the employers and say, do you know what your smoking is costing you in terms of a workforce? Sick days, time lost because they're out cigarette breaks, etc., illness, general stuff like that. It's expensive. And you're investing a lot of time and energy into your workforce to train them, to put out a product. If you lose them because they're sick, that's lost. That's additional loss beyond just the work product lost. So if you really care about your employee, you really care about your neighbor, these are the things that can help you protect you and make sure they're staying healthy and active and productive, whether it's good health choices in terms of food and activity or just getting vaccinated. These things will keep you alive longer and healthier and happier. And I think everybody can agree that that's what they want. So,
can't disagree with that.
no.
All right. Thanks so much.
Sure.
I hopefully won't have to ask you to talk about this sort of thing again.
Well,
but,
you're welcome
maybe
to.
we can talk about something else another time.
You're welcome to.
Okay.
Thanks.
That's it for this episode. As always, you can reach me at jamesh@polklore.com with your feedback and suggestions for guests. Thanks for listening.